Hello guys, so now we shall be discussing about the 11th pair of cranial nerve, that is your accessory nerve. Okay, so a topic of discussion would be regarding the accessory nerve. So accessory nerve is also called as your 11th cranial nerve number 11. Okay, so cranial nerve number 11, and remember one thing, that this accessory nerve is purely motor nerve. Okay, so this is completely your motor nerve. Now, within this accessory nerve or within this motor nerve, there are two different roots. Okay, what are those two different roots? One is called as the cranial root, another one is called as the spinal root. Okay, so there are two different roots over here. One is called as your cranial root, another one over here is called as your spinal root. Now, what do you mean by spinal root and what do you mean by cranial root over here? So, but before we discuss all these things, first of all, what I will do is that I will draw the spinal root nerves, and later on I will draw the cranial root nerves. Cranial root, you know, they arise from the central nervous system, that is your medulla oblongata. Spinal root, they arise from the spinal cord. That is the only difference. So, from where does this hypoglossal nerve arise? It arises from your medulla oblongata. So, let me draw the medulla oblongata structure over here so that you would understand it better. Right, you know that right now I am drawing the pyramids, and these structures which I am drawing on either side are called as your olives, right? Right, so these structures on either side are called as your olives. Here also this is called as olives. Okay, so these are the olives. And second most important thing you need to know over here is that here we are surrounding this in a particular foramen over here, and this foramen is called as your foramen magnum. So this particular foramen over here is called as foramen magnum. So this particular foramen over here is called as your foramen magnum. Next side here we have got another foramen. So this particular foramen which you can see here, this is called as your jugular foramen. So this particular opening over here is called as your jugular foramen. So this is called as a jugular foramen, right? Now the second important thing which you need to know is that I told you cranial root and spinal root. So the nerves that are coming out of this particular drawing which I have drawn, this is called as a cranial root. Now coming to the spinal root, the nerves which come out of the spinal cord comprise of spinal root. Let us say this is a section of your spinal cord like this, right? So the nerves which are coming out of this particular spinal cord is called as your spinal root. Now in the spinal cord also, from where are these nerves coming out? These are coming from the lateral aspect of your spinal cord or lateral aspect of your anterior horns. So this is your anterior horn side, and the upper one is your posterior horn side, right? So if I'm dividing like this, the down one is called as your anterior horn, the upper one is called as your posterior horn, right? So from the lateral aspects of the anterior horn, you got a nucleus there. Actually, this nucleus is called as spinal accessory nucleus. This nucleus is called as spinal accessory nucleus. Okay, now from this spinal accessory nucleus, you see a nerve that is going up like this. Clear? Now this particular nerve which is going up, what is going to happen? This is the nerve. This is the nerve which is going up, and it is coming out of which foramen? This is called as your foramen magnum, right? And then it is taking a turn, and now it is entering into a foramen called as jugular foramen. Now from this jugular foramen, this nerve gives branches to two more nerves like this, right? So what are these two more nerves? Actually, what is this nerve now? This nerve is called as spinal accessory nerve. Spinal accessory nerve is coming from which nucleus? Spinal accessory nucleus. This spinal accessory nerve is it is passing through which foramen? It is passing through jugular foramen. After passing through the jugular foramen, it is giving innervation to which muscles? It is giving innervation to two important muscles. So one muscle is called as your trapezius, and the other one muscle is called as your sternocleidomastoid muscle. Sternocleidomastoid muscle. So there are two important muscles. One muscle is called as your trapezius and the other one is called as your sternocleidomastoid muscle. Now this green color nerve root which I explained you is called as your what? This green color nerve root which I explained you is called as your spinal nerve root. Now when it comes to the cranial nerve root, now cranial nerve root starts just medial, okay? Just medial to this olives, we have got a nucleus here. Medial to the olives, we have got a nucleus. So this nucleus is called as nucleus ambiguous. What is this nucleus called? This nucleus over here is called as your nucleus ambiguous. Now this is called as nucleus ambiguous. Now from this nucleus ambiguous, what is happening? You see the fibers that are coming like this, and these fibers, what they will do is that they will pass posterior to the olives, back of the olives, and they come onto the side of the olives like they are passing back of the olives, and together they form a nerve like this, right? Now what is the name of this nerve? This is called as a cranial root of accessory nerve. Okay, so what is this nerve here? This is called as your cranial root of accessory nerve. Now this cranial root of accessory nerve, what will happen is that it passes down all the way through the same foramen. Which foramen? That is through the jugular foramen, and then it comes out of the jugular foramen down. It comes out of the jugular foramen down, and it gives innervation to three important groups of muscles. So the first group of muscle it gives innervation is to the muscles of palate. So to the muscles of palate. Second group it gives innervation is to the muscle of pharynx. Muscles of pharynx. And the third important group it gives innervation is to the muscles of larynx. Muscles of larynx. So what are the three groups it is giving innervation to? One is called as the muscles of the palate, next muscles of the pharynx, third is muscles of the larynx. Okay, so these are the two important roots which you need to know. One is called as a cranial root which gives innervation to trapezius and sternocleidomastoid. Another one is called as the spinal root which gives innervation to the trapezius and sternocleidomastoid. Another one is the cranial root which gives innervation to muscles of palate, pharynx and larynx, right? So this is all you need to know regarding the accessory nerve. So thank you so much for watching my video. Goodbye.